Welcome back to the Community of Innovation podcast brought to you by the Center for Aging and Brain Health Innovation, otherwise known as CABHI. I'm Allison Sekuler, President and Chief Scientist at CABHI and the Baycrest Academy for Research and Education.
And I'm Rosanne Aleong, Executive Director of Research, Innovation, and Translation at the Baycrest Academy and the Director of Research, Innovation, and Translation at CABHI. In honor of Canada Road Safety Week, we'll be talking about driving and dementia. In this episode, our guests will explore the impact of dementia on driving ability, safety, and the emotional journey of older adults losing their licenses. We'll also look at resources like the CABHI-supported Driving and Dementia Roadmap. The website, as featured in the World Health Organization's Global Dementia Observatory Knowledge Exchange platform, provides support for individuals living with dementia, their care partners, and healthcare professionals. Okay, Allison, another 3 amazing guests with a really dynamic conversation about driving and dementia. What stood out for you?
I think what stood out for me most was one of our guests, Mary Beth Whiten, who's an international dementia advocate. She pointed out that if you've met one person with dementia, you've met one person with dementia. In other words, every person has a different journey. Every person needs to be treated in an individual way. And that personalized approach to dealing in this particular case with driving and dementia is just so critical. So I thought that was really important for her to be highlighting for us. What stood out for you?
I loved our guests having a conversation about not only the technical aspects of driving, but it's not just transportation. There's an entire emotional journey associated with driving. They talk about the fact that it relates to identity, it relates to confidence, it relates to their own sense of personhood. And so when you have this conversation, it's not only getting from point A to point B, it is so much more encompassing in a person's life. And so I think they really encourage our audience to think more holistically about this topic.
Yeah. So let's get from point A to point B to the show. Our first guest is Mary Beth Whiten, an international dementia advocate and author who has greatly impacted Canadian government policies on dementia and human rights. After being diagnosed with probable behavioral variant frontotemporal dementia at the age of 45, she had her driver's license revoked immediately. She is a Behavioral Supports Ontario Provincial Lived Experience Facilitator and past chair and co-founder of Dementia Advocacy Canada. And Mary Beth also was instrumental in helping design the first Canadian National Dementia Conference and was a member of the first Canadian Ministerial Advisory Board for Dementia. So Mary Beth, great to see you again, and thanks for being here.
Thank you very much for having me.
Our second guest is Dr. Gary Nagley, a University of Toronto professor, a geriatrician, Vice President of Medical Services and Chief of Staff, and Chief of the Department of Medicine at Baycrest. He is also a scientist at Baycrest Rotman Research Institute. His research focuses on driving issues in older adults with cognitive impairment and dementia. Gary, thank you for joining the pod.
Thanks for inviting me. I'm delighted to be here.
And last but not least, our third guest is Dr. Mark Rappaport, a University of Toronto professor and the Residency Program Director in Geriatric Psychiatry. He is a past president of the Canadian Academy for Geriatric Psychiatry and acting head of Geriatric Psychiatry for Sunnybrook Health Sciences Centre. His main area of research focuses on motor vehicle collisions associated with neurological and psychiatric illness in older adults. Welcome, Mark.
Thank you for having us.
So today we're talking about driving and dementia. And Mary Beth, I wonder if we can start with you and you can walk us through what life was like for you before your dementia diagnosis, and what did driving mean to you, and how did it feel to lose your license? How did that affect your daily life and your quality of life?
I guess that's why we're all here, right? How does that affect us? Before my diagnosis, I was a very independent woman, and I did a lot of traveling for the work that I did. And one of the things I used to love to do was to rent a car in whatever country I was in and take off. And it was just so much fun to be a part of that. community through driving. What it meant for me once I lost my license, it was really, it was a terrible way to receive the diagnosis, first of all. So the doctor sat me down, said, "You have probable frontotemporal dementia." And I don't even think she took a breath. And then she said, "And you can't drive effective immediately, period."
Wow.
And so what happened then was it was just like my brain couldn't even absorb the first part, which was the diagnosis. Went straight to, "You've lost your license effective immediately." And that's all I could hear. I stopped listening to her. I couldn't hear what she was saying at all. And I ended up stomping out of her office and waiting for my partner, Dawn, with the keys. And I had to hand those keys over to her, and she drove us home. Brutal.
Yeah. And since then, I mean, how has your daily life been affected by the loss of the ability to drive?
Well, one of the things that happened is we had to get help because I was still out in the community doing things. And we have a daughter who was 17 years old at the time of diagnosis. We ended up buying her a car so that she could, drive me here and there. And frankly, it drove me crazy because I hated the way she drove. She was a 17-year-old. And so not only was I not driving, but I was in the car with someone who was driving me crazy. So it definitely had a huge impact on me. And I went into a depression, I would say.
Oh, that's horrible. And your independence also, presumably. I mean, you said before
Yeah.
before you like just rent a car, go wherever, your freedom, the spontaneity of life, presumably that was
Yeah.
disrupted.
Lost. It was definitely disrupted, lost. And, now it's almost, I have to look to my bicycle to kind of, if I want to take off and go somewhere. So the whole spontaneity of life. And if you are a driver who enjoys driving and you get that taken away from you, then it's a huge blow to your ego. It's a huge blow to who you are. And you definitely lose, for a long time, I would say, that wonderful feeling of getting into a car and driving.
Can I hone in for a sec? Because something so critical what Mary Beth said that I would just like to emphasize is when the issue of driving comes up, I think too many people focus almost exclusively on this being a means of transportation to get from point A to point B. But what Mary Beth so eloquently pointing out is driving means so much more to people than this.
Yes.
Than just being a mode of transportation. People's sense of autonomy, their sense
Yes.
of self, and sometimes who they are. If part of their role in life is to drive their grandchildren to and from school and to and from their activities, and you take that away from them, you're taking away from them a major part of their life and what gives them a sense of fulfillment and contribution. And hopefully we'll get back to that a bit during the podcast so we can speak a bit more about the importance of addressing those issues.
It's a really important point because people sometimes will say, well, you could just get an Uber these days, but that doesn't really get to the core of what these issues are.
I was also going to say, getting your license is a huge milestone for many people. It's a rite of passage to become an adult. So losing it, I think, is equally a milestone in the opposite direction, I think, in that sense. But I'm going to bring us back. And Gary, thank you very much for that. But I want to bring Mark also into this conversation because both of you lead the driving and dementia research team for the Canadian Consortium on Neurodegeneration in Aging. And CABHI supported your project, the Driving and Dementia Roadmap. So I know this is a very long-standing partnership, so I'd love to hear how both of you got into this area of research and what exactly is the Driving and Dementia Roadmap. Gary, why don't we start with you?
Thank you. Mark and I probably got into the issue of driving as it relates to older adults close to 20 years ago now. And I can certainly speak to why I got into it and I'll allow Mark to speak for himself. But just to get right to the crux of the matter, one of the most challenging things that I faced in my clinical work dealing with many people with a diagnosis of dementia was the issue of driving, which was something that, I mean, if I'm candid, was something I least liked in terms of the clinical work I had to do for the many reasons that Mary Beth brought up. It's something that's very poorly received by the person I'm supposed to most help. I think Mary Beth pointed out another really important element, which is as a specialist, I'd often be referred someone, and the issue of driving had never been raised, not by the primary care physician, not by family members, not by the person that I was assessing. And suddenly, as this person who I'd never met before, I'm doing a first-time assessment. At the end of that, I have to tell them, based on my assessment and my knowledge of driving, I do not believe that you remain safe to drive and you'll have to stop driving. That's got to be one of the worst things for a clinician to have to do to a person they haven't had an opportunity to develop a rapport and a relationship with. I guess I knew enough about driving to know how critical it is to people, and that giving up driving is a major life transition, which I say is equivalent to losing a spouse, to moving into a nursing home. It's that level of transition. It's that important and is so impactful. So because I liked it so little, having to deal with it clinically, I said, maybe I should research it, because maybe I could do some things in the context of my research that may make it a bit easier in the future for the people with diagnoses of dementia, their family members, and for the clinicians who need to deal with this issue. So that's my backstory.
Mark, your entryway into driving and dementia?
So yes, Gary and I were working on driving in older adults starting in 2004. And this was a national program that was very exciting and really a new area of research in Canada. And what impressed me, unfortunately at the time, was that very often when people talk about older adults driving, they think that we're talking about dementia. But those are two totally separate topics. And Gary and I were the only physicians in Toronto that were part of this program. We both had large dementia practices, so we were very interested in collaborating and doing some specific work about the dementia population. I also clinically at the time was had a very large traumatic brain injury research program for traumatic brain injury in older adults, and one of the biggest challenges is that there's no cure for traumatic brain injury except for prevention. And so driving being one of the top two reasons that older adults get into traumatic brain injury, this was a way to contribute the work on older adults and driving. And really, if we can prevent motor vehicle collisions in the first place, that would be ideal. And so when it comes to dementia, we often think about it's better to stop driving proactively an hour, a week, a month, a year too early than 1 second too late. But that's only works if people can continue to live after they stop driving, because the flip side is, as Mary Beth indicated, just so devastating. We don't want people to stop living after they stop driving.
I think we're really hitting it, which is it's not just about getting from point A to point B. It really is about the personhood of someone that's been lost.
And I guess, Mark and Gary, can I follow up on Mary Beth's comment? Does the driving and dementia roadmap hopefully help people in maintaining that sense of personhood? And is a tool in that sense? I don't jump in.
I'd like to think that it does. Some of the important aspect for people to understand is when they use the resource, the Driving Dementia Roadmap, is to recognize the work that went into it. And in fact, I know Allison and Rosanne probably relate to this. It was 7 years of background work and rigor to get us to the point. And some of that involved very extensive reviews of existing literature, a number of qualitative studies, having an advisory group of people with lived experience, as well as healthcare providers, really trying to understand the issues. And in our qualitative work, time and time again, the issues that Mary Beth emphasized about the importance of driving to people beyond just transportation, the very emotional aspects associated with driving. We developed sort of what we call an intervention framework, and we very specifically two separate categories. One was called the practical aspects and all the things that we thought that the roadmap needed to address. And then we had a separate category, which was the emotional aspects and all the subcategories of that we felt that the roadmap had to address. And we hope that the roadmap does try to address some of the emotional aspects and give some suggestions. And certainly we talk about things like developing a transportation plan. But the notion of the transportation plan, again, although maybe we don't explicitly state it, is that it's meant to provide, again, some control for the person with dementia to do the activities that they want to do. And I guess the only other thing I'd emphasize, one of the underlying objectives of the roadmap is to get people with cognitive impairment at early stages to start addressing this issue so that they have the voice in making the decision to stop, and they have the voice in planning for what does life look like after they stop. There are many studies that have clearly showed that if an adult with dementia participates in the decision and planning, the outcome for them is dramatically better than if it happens very suddenly, as Mary Beth says, or Mark and I seeing someone who's already in a later stage of dementia when we first see them and no one's addressed this issue at all, and they're told. So we're really hoping that this will start much earlier conversations about this and that people can address some of these more emotional things. And if driving was important to their life in terms of how they did things or what they did, that it could be substituted. They could think ahead of time, okay, I can't do this with my grandchildren. Instead, maybe I can do something else that won't depend on driving.
Yeah. Meredith, did you want to join in here and say, what would your life have been like if you'd been able to have a role in that a little bit earlier?
Oh, I mean, you hit it right on the nail. I think that whole dialogue, instead of just slamming me without any type of, even a mention of driving, would have made a huge difference, because then we could have talked about the actual diagnosis without me stomping off because I was mad and I had lost my license. So totally agree. Yeah, really important, Gary.
Yeah. And Mark, I wonder if you can speak a little bit about what some of the early warning signs might be that folks would experience when it comes to driving difficulties. I mean, so you've talked before about the importance of catching it early, better early than late. Gary, you're talking also about how do you engage people earlier. So Mark, what would people be looking for? What are some of those early warning signs?
Yeah, everyone seems to think that it's really all about the most dramatic signs, like a car accident or mixing up the gas and brake pedals. Those happen later in the course of dementia. By that point, it's really dangerous. But there are some more subtle early warning signs that are important to know about. I think the most common one is a reduction of driving. So driving much less, driving in restricted circumstances. On the one hand, that's a wise thing to do, and accommodating to normal changes in age with night vision, that's a good, wise thing to do. On the other hand, in dementia, it can be an early warning sign that there's something up, there's something different that the person is aware of, and it may pertain to cognition. So it starts with a reduction in driving situations and total driving time and distance, but then, a loss of confidence. We have a lot of warning signs, by the way, on the driving and dementia roadmap. So these include difficulty turning to see when you're backing up. That's a very difficult task to do that can stop early. Sitting on the brake too much, being distracted, having trouble with getting the exact signal right or the timing of signaling. Families often tell me that they're noticing some unexplained scrapes or dents on the car or on the garage or a mailbox as people get into the road. And so those can be early things that people notice before things get more serious with driving.
Yeah. And Gary, it's important to take a baseline into account, isn't it? Because some people are going to have a lot of dents in their car, even as younger folks before they might have any issues to do with aging or dementia. So knowing someone's baseline behavior is going to be important as well. Is that right?
Yeah. So thanks for raising that. So one of the things I emphasize with my trainees is the importance of change, right? Is identifying change. So, I'll give you a good example. Like you want to take a good driving history, which would include questions about collisions, but you're also asking if they've had any driving tickets other than parking tickets or things that may be warning signs. But taking it in context, so I'm interviewing a patient and they got 2 speeding tickets in the last 6 months. And the daughter is telling me he's had a heavy foot all his life. And, that's pretty standard, having a couple speeding tickets every 6 months. So it's very true that you're looking at change. I did want to add a few things to what Mark said, if I may.
Sure.
I sort of look at driving as one of the most cognitively demanding, regular routine tasks that all of us do. And the reason that's really important is when we make a diagnosis of dementia, it really involves 2 separate elements. One is impairments, problems with cognition. And the other important element is it has to be sufficient to the extent that it starts impacting a person's ability to function. So there's something that we call instrumental activities of daily living, which are sort of higher levels of activities. So this could be things like financial planning to make a meal, managing medications, things like that. The reason that becomes important is my view is driving is actually at the top of these higher level activities. So what I try to educate the person living with dementia and their family members is if they're seeing that their cognitive problems are interfering, for example, with their financial management or being able to manage medications, almost certainly it's going to be interfering with their driving as well. So besides giving them the clear red flags, Mark mentioned some of them, others, you being able to maintain the lane, making left-hand turns against traffic, for example, is extremely demanding because you have to keep an eye on the light, pedestrians, oncoming traffic.
Yeah.
So I want family members and the older adult with dementia to focus on the driving related things, but also more generally, if they start noticing having problems managing their finances and that's something new for them, then they need to be aware that that's likely a real warning sign for driving. And then you emphasize with them, a majority of the driving we do is a reflex in essence. The sensation we all get, we've driven somewhere and we get there and you sort of have completely blanked out and you have no idea
How did I get here?
how you actually got there. And that's because so much of driving is much like a reflex. But the problem with driving is you have those very short periods that require very sudden judgment and decision making, incorporating all kinds of information. And so you can judge the regular routine reflexive type of driving as being a strong indicator. And the other things don't happen necessarily often enough. So you look for some of the red flags about, you're not keeping the car in the lane so much, or you're having a bit more trouble with those left-hand turns. You're more anxious when you're driving. But just think more generally, if other important activities are problematic, driving probably is as well.
And Mary Beth, I'm wondering, do these sorts of early warning signs, does this resonate with you? Did you notice any of this in advance, or did your diagnosis and your requirement to stop driving come more out of the blue?
I would say it came as a surprise. But if you talk to my partner, who all of a sudden it seemed like she said, yeah, we were a little bit worried when I should have always felt safe with my driving, but had noticed a change that I seemed not paying attention to the road as much. So I was, turning my head to the left to watch whatever was going on. So, yeah, I guess it was there. And one of the other things that I didn't realize then, but I do realize now in reflection, is decision making is very challenging for me. And we all know how quickly you have to make decisions in driving. And so mine are always a little bit slower than they used to be. Just obviously that's not what we want.
Yeah. And every little change adds up when you're driving and every millisecond counts, right?
Exactly.
Yeah.
So dementia is a journey, and we've talked about some of the early warning signs, and Mark and Gary, you've shared quite a few of them with us. But what kind of changes happen as dementia progresses from a mild stage? Gary, maybe I turn to you to start us off.
Well, I can just sort of follow up on what I was saying, right? As the neurodegenerative dementia progresses, your cognitive problems get progressively worse, but they also start impacting your functioning more. So I talked about we have the higher instrumental activities of daily living that get impacted earlier. But then as it progresses, your more basic activities become impacted as well. So things like dressing, and in the early stages, a person may be able to dress themselves, but they're having much more trouble choosing their clothes, selecting the clothes. Or you might get comments like, why are you wearing your heavy fall coat in the middle of the summer? Like, that's not appropriate for the weather. So you can start picking up having difficulty making good selections with the type of clothes, but they can dress themselves, right? So not being able to dress yourself would be like a further stage. But people need a bit more cueing, right? They're not grooming themselves as well. They could do it. They could take a shower. If it's a man, they can shave, but they're just not attending to it. Or with clothes, they forget to put them in the wash and they sort of selecting the same clothes to wear every day. So you start seeing the effect on these various areas. And certainly with driving, I mean, Mark sort of pointed out, like at a late stage, it's people not being able to distinguish the brake pedal from the accelerator pedal, which is horrifically scary. Of course, they may even forget, how to start the car. They can't figure out to put the key. And now, of course, these days we have push buttons in many cars, so that may be easier. But the point is you start having more gross, obvious errors or problems with driving that become clearly more apparent. But that's also in the context of many other areas of functioning being impacted. So I hope that answers the question.
I do have a follow-up that I'm going to turn to Mark for. I'm just wondering, there are different types of dementia, and across those different types of dementia, are some of the challenges that you and Gary talked about consistent, or are there potentially differences?
Well, this is an area where there isn't a lot of good research, but there are potential differences, right? So, for example, there are some rapidly progressive dementias that go from no symptoms to severe symptoms, bedridden over 6 months. That's a particularly dangerous type of illness with driving. There are some types of dementia where judgment is affected in early stages, of course, not with everyone, but sometimes with a frontotemporal dementia, there can be a extreme irritability and impulsivity, which can be dangerous behind the wheel. There is a condition called Lewy body dementia, which is a cousin of Parkinson's dementia. And in that particular circumstance, not only is there slowing, but there may also be visual hallucinations, which can be dangerous, and then also visuospatial difficulties, which altogether can be particularly dangerous. I think it's really important to know what type of dementia the person has and to factor those and how it's affecting them, because not everyone with Lewy body dementia will have the same symptoms or frontotemporal. So everyone is different. So knowing the disorder and knowing that person together can come up with a more refined plan.
I love that you paired the type of dementia, but also the person themselves. So the emphasis on the individual. Mary Beth, before we move to the next question, I want to give you a chance to share your thoughts and whether these comments have resonated with your experience.
Well, they do resonate. And in particular, I really appreciate that the saying goes, if you've met one person with dementia, you've met one person with dementia. So, Mark, I think you've done a great job capturing that, which is, yes, I might have this type of dementia, but let's not react to that symptoms that are in a book. Let's talk about Mary Beth Whiten, who wasn't a speed demon and who didn't have those tickets, and putting all that into a package. So that's really important. Let's talk to the person who has the dementia. Let's talk to the people who know her or him, and then let's start to make big decisions.
Yeah. And just following on that theme of the individual, and we talked about this before, it's the change almost that's really important. If there is a concern that someone may not be safe to drive anymore, that's going to look different in each individual because of their starting points and their baseline and who they are, their habits, and so on. So, Mark or Gary, I wonder if we can start with you. What are some of the resources available to assess if someone actually is safe to drive?
So I think with this, I think of this as a team-based approach. We all have one perspective. So let's start with the person with dementia. It's important to first ask them, What is their perspective? What have they noticed? Now, there's a limit to that because in one of the challenges, particularly with Alzheimer's, dementia, and some other times in some people with other dementias as well, there can be a lack of insight. So they may not be aware, whereas other people may be aware. It's still important to ask them their perspective, because when you know their perspective, you can plan your intervention. If the person says, I have no problems, I've never had any problems, I've been a driver for 60 years, I've never had one scratch or a crash, although we can then plan how we will interact with them and how surprised they're going to be if we have concerns and recommendations to share that are other than keep on doing the best job that you can. So then we talk to the family, because they presumably have a good sense of how that person's doing. We as healthcare professionals, we only see them for a short period of time. The family members of someone with dementia, the people that are very close to them, they may be aware of these early warning signs that we've talked about. And they also have the opportunity often to drive with the person with dementia and see and make observations that we don't get to see. Now, there's also conflict of interest there as well. We have a lot people whose spouses, that the family caregiver may have visual impairment and be unable to drive and rely on the person with dementia to have a good life and to get to all the social engagements and see the grandchildren and so forth.
Or in my case, I drive really fast, and my family would like me to, they never feel safe because I drive too fast. So they would love to have me not be able to drive them. That's a different kind of conflict of interest.
Well, yes, but there's concerns about, behavior like eating, but also there's ageist assumptions too. Some people say, oh gosh, my dad's 85, is he really that sick? But they're squeamish, but they haven't ever observed them drive. So it really has to be all about observation and keeping it critical. That's why we're talking about a team approach.
And the change.
Yeah, everyone has a piece of the puzzle there. Then the clinician knows the book knowledge, as we've talked about. They know how dementia can affect driving. They may know this better than the person with dementia or the family. They've seen. They also have a lot of clinical experience. They've seen lots of people with dementia who have and don't have driving problems. So they have pattern recognition. What they don't have is the detailed knowledge of that person, and they compared to the person themselves and their family. And we also never see them drive. So the final part, the fourth arm of that team, is a specialized on-the-road driving assessment. Now, this is a specialized for people with dementia, and it is meant not to pick up bad habits, because everyone has bad habits as they have years and years of experience driving with good and bad habits. But this is looking for dangerous behavior on the road. It involves, they are expensive, and they're expensive because there's not only a driving instructor in a specialized test, but there's an occupational therapist who rides in the car and makes observations. So it's two professionals making observations. And that right now is the gold standard. There may be better solutions in the future, but for now, those four approaches, the patient, the family, the healthcare provider, and the on-road driving assessment, that's probably the best way of getting all the perspectives. Now, of course, then it's up to the healthcare provider to pull all of that together. And now that we have this information, so what? And by knowing that person with dementia's perspective, you can maintain their dignity and allow them to value their years of experience in driving without an accident and their caution financially and all their things that they've worked towards, what's most important to them. By knowing that, even if it's bad news, you can continue to work with the person.
I'd like to emphasize one point. So we do rely a lot on family members or people who are close to the adult with dementia, because we think that can be an important source of information. But Mark raised a really important point, because as we know, age is the strongest risk factor for dementia, which means many of the people who receive this diagnosis are the oldest of the old. And there is a lot of ageism and stereotypes that you really have to guard against. So, anecdotally, an experience where, one of the people I was assessing, their daughter said exactly what Mark just said. My mom is 88, and I'm really concerned about her driving. Yeah. So then I asked what I think is the critical question. And I said, well, when's the last time that you actually drove with your mom being the driver? And she said, probably about 3 years ago. So I immediately discounted the
Yes.
daughter's concern, not because I don't respect the daughter, but I need to be fair to my patients. And I'm not going to
Yes.
take the information from someone who hasn't even observed them driving and raising what is these paternalistic concerns. We don't want our very old parent to drive. So that's an important point. The other learning I've had over the years, which I hope the Driving and Dementia Roadmap helps, is to just tell a family member or friend, well, drive with them at least once every 4 to 6 weeks and let us know if you have any concerns. That's a pretty broad thing. Like, what am I supposed to look for? So what I do is I review with them some of these red flag things like driving above and below the speed limit, maintaining the lane, making a left hand. So I give them very specific types of driving skills that I want them to observe. And I think they find that much more helpful than this general statement, watch them drive and let me know if you have any concerns. So having people actually drive and observe, because they're, as Mark eloquently, I love the way he put it, the team, they're an important part of the team. So they have to actually observe, but you have to help them understand what you want them to observe so they can bring back useful information.
Yeah. And the context presumably is important too, because people driving on the 407, which is one of Canada's paid highways with less traffic, people drive a lot faster there than they do, say, on the QEW, which is always really crowded. So taking that context into account is probably going to be important too. But I wanted to ask Gary, when Mark was talking about the specific driving assessments that are done where there are different people in the car who are watching, before y'all had said that some of the sorts of changes in driving patterns may not always be occurring, but they might be occurring here and there. So that's presumably where having family members and friends watching is useful. When people are doing that other kind of gold standard assessment, as Mark put it, what is being done there to make sure that someone's being challenged in a way that can help to reveal some of the challenges that might be coming across from dementia with driving?
It's an excellent question. And as is implied in the question, is a reason why the actual driving assessment may not be completely valid. So in other words, possibly if you repeated the same driving assessment on a different day under certain different conditions where there are more or less pedestrians at a left-hand turn, you may find something that you didn't. Right. So they're imperfect in that regard. But there's a few things about it that perhaps help a little bit. One is you're not driving in your own vehicle. So to a certain extent, that's a test. We're all very comfortable driving in our own vehicles. So by virtue of being in some complaint like, it's not fair, you're making me drive in a foreign vehicle. But, inherent is yes, they're sort of recognizing that's true. But if someone's truly a safe driver, that shouldn't be enough to make their driving unsafe, if you know what I mean. Or similarly, I get this often, my patient says, oh, the test was completely unfair. They made me drive on the highway. I haven't driven on the highway for 5 years. And the driving assessment centers are aware of this. But those are, Allison, sort of like you said, you suggest that's a bit of a stress test. So you may drive a bit more slowly on the highway, but you'll be able to drive safely on the highway. Yeah. So these are some of the things, but it's imperfect. And maybe Mark can speak. Some of the studies that we're about to embark on are meant to try to solve this particular problem.
Yeah, Mark, you want to chime in real quick?
Right. I was just going to add, in terms of the stress test, one of the things that these specialized driving tests do is they often start off-road by doing cognitive tests in the office. And our patients will often tell us that, oh boy, my English is not my first language. A lot of these tests were very English specific, or they made me use a computer. There's this useful field of view test that we talked about that, but I've never used a computer before. I don't know how this works. It's a foreign. So if I had trouble with it, it has nothing to do with my driving. It has to do with my interact with the computer. So with all that said, I mean, we're looking at other alternatives, but don't have anything really to report in yet. I hope that in 5 years from now, we'll have some different ideas about what my
so we're looking at
we'll make a date 5 years from now coming back on the podcast.
We're looking at in-vehicle technology, so GPS tech devices and cameras, and it's going to be sort of more continuous in the person's vehicle where they drive. Yes. So we hope that will be a solution, but we're just in the early stages.
And we can talk about how we integrate closed loop EEG into that too. We can chat about that offline.
Absolutely, that'd be great.
So I want to come back to, I think, Mary Beth, your actual first comment about the emotionality and just, the fact that that first conversation with your clinician was very emotional for you, is angering for you. And Gary, you also said that the Driving in Dementia roadmap has that emotional component, but that practical component. So I think we all acknowledge that these kinds of conversations can be tough and bring out a lot of emotion, like anger, like a questioning and confidence and all of those pieces. But I guess I'd love for us to have a collective conversation about what's the best approach to this topic with someone living with dementia. And Mary Beth, maybe having lived through that conversation personally, what would your advice be on how to tackle this type of conversation?
Well, I think there's a couple of things to consider before even broaching the topic, which is evaluating the relationships of the person who you're working with. So for instance, the person who's coming in with a daughter and they're not quote unquote loved ones, but they have a stressful relationship. And so for someone to suggest to the daughter, well, we really think it'd be best for you to talk about this, your mom not driving anymore. Well, that's probably not going to go very well for anybody. And so in that particular situation, what other things can we evaluate? For the doctor with me, just to lay it out there for two incredibly serious decisions thrown at me, obviously my brain can't take on all of that. It was a bad decision on her end. So what could have changed with that? First of all, we should have talked more about the demise of my ability cognitively to do those functional things that both Gary and Mark have been talking about. And so there's almost a lead-up conversation. So Mary Beth, are you struggling a little bit with making decisions? Oh, yeah. And how, your money, you're still understanding your banking system. So bringing in those extra things outside driving that can help influence the decisions on how do we go forward with this, I think is a good guide.
So Mark, Gary, on the clinician side of that conversation, what are your thoughts of the best way to tackle those emotional conversations with whether it be, actual individuals living with dementia or their family, friends circle? Mark, why don't we start with you?
I think the most important thing is to have the conversation. And that may sound intuitive, but when we've done research, what we realize is nobody wants to have this conversation. Certainly not the person with dementia. The family members are very anxious about it. Even the healthcare providers avoid discussing it because there's nothing like talking about losing a driver's license to wreck your relationship with your patient. So as a result of that, people don't want to talk about it and they don't talk about it. So step one is to have the conversation and to lead with empathy and think about not just the thorny legal issue about reporting, because that's very important. There are laws that the physicians and certain other healthcare providers have to follow, but also about supporting. And so if you bear in mind not just the police side of it, the reporting, but the actual supporting, I think bearing that in mind really eases a lot of the conversations and finding out different people's perspectives. That's my main suggestion.
Gary, this whole conversation started with you not enjoying this conversation. So please weigh in.
Right. So first of all, as Mark pointed out, we have a paper that we published in the Gerontologist. I believe the title is Hot Topic, Always on the Back Burner. So through our qualitative interviews, it just comes up time and time again as people will do anything to avoid talking about this. So, that has so many elements to it. Like most at a very general level, I think just the general public needs to have an awareness that if you live to a very old age, you will almost certainly at some point have to stop driving because of some type of medical condition. Not only dementia is
Physical
one category.
or others, yeah.
Physical, it could be there's all kinds of eye pathologies that are more common. There just seems to be a complete lack of knowledge amongst all of us that we're not going to drive to our own funeral. that at some point we're going to develop a medical condition or medical conditions that will result in us having to stop. So it would be great to have more public education so that generally people aren't surprised by this. The other thing, Mary Beth, as is always the case, is right on it, right? You can't prescribe who amongst families should have the discussion. And the Driving Dementia Roadmap has this great, number one, they have videos of sample conversations that don't go that great always, or certainly at the beginning, that you can view to help you. But there's also a worksheet that goes through things like who should have the conversation, when should you have the conversation, what should you include in the conversation, because all these things are relevant. And as Mary Beth points out, it might not always be who you think is obvious. It might not be the spouse or the daughter. It might be a best friend that the person has had for years, that they have a very strong relationship that they may be more open to listen to. So the Driving Dementia Roadmap have some great tools to help with that. And, my plea goes back to the comments I made earlier from the physician perspective, is the earlier in the face of some cognitive problems that you start having these conversations, the better. Because I can assure you, Mark and I, unfortunately, have been in circumstances that Mary Beth is pointing out, where we assess a person for the first time and they're already in a moderate, severe stage of dementia. And on the same visit, I have to tell them about the diagnosis and about stopping to drive. And I dread it because Mary Beth, trust me, I understand that that's not the best thing to do. But because of my legal requirements, I can't just say, well, come back in 6 weeks after you've digested the terrible diagnosis I just shared with you. And then
Gary, I would have had to fire you like I did.
I've been fired many times, Mary Beth, unfortunately.
I bet you have.
But I'm just pointing out so the point of emphasis for me is it puts us in a very uncomfortable circumstance that we don't want to be in. So it's all about educating people to start having these conversations very early, like even with a diagnosis of mild cognitive impairment. Look, we don't know at this stage whether this might be something that progresses, but you have to be aware that if it does, at some point, driving. So that's my plea to everyone.
Just early. The earlier you bring it up, the better. And this is leading into sort of final take-home messages. So, Gary, would that be your final take-home message? The earlier you can start having these conversations, the better? Or is there another take-home message you'd like to leave?
The earlier, the better, and making sure that the person with the cognitive problems is able to participate, because that's what results in the best outcomes. We need people like Mary Beth to participate in when I need to stop driving and what are things I'm going to do after to ensure there is life after driving, I promise. Yes. But we as health providers have done a poor job at supporting our adults with dementia to make this adjustment. And that's a commitment that we need to make.
Mark, what would your take-home message be for our conversation today around dementia and driving?
I think open the dialogue, continue the dialogue. It's often not a one-time discussion. It's something that needs to be assessed and managed and discussed over time.
All right, great. And Mary Beth, I want to give you the last word on this. What's your take-home message for folks having lived through it?
Having lived through it, I really like the idea there wasn't a tool back in the day. So for physicians to be able to utilize this tool, the DDM tool, first of all, I think it should be used and talked about. And can we get Health Canada to push some information about road safety also includes perhaps dementia. And I mean, we haven't even talked about rural Canadian drivers.
Access.
But that's another podcast, Allison. So
yes, we'll have you back for that one too.
So as we close this episode, we always ask our guests for their recommendations about resources that our audience should check out. I have a strong suspicion of what Gary and Mark will offer, but I want them to actually tell our audience where to find the Driving and Dementia Roadmap. Mark, where should our audience go?
So the link for our website is drivinganddementia.ca, www.drivinganddementia.ca. And if you put that into your browser, that will take you to this roadmap that Gary and I and Mary Beth have been discussing today.
Perfect. Thank you. Mary Beth, what resource would you want our audience to check out?
I'll do a shout out to the Alzheimer's Society of Canada. They have done some amazing work on their web, and they have a whole section related to this go there, read, absorb, and talk.
And just to follow up on Mary Beth's comment, if I may, because I was going to say the Alzheimer's Society as well. So number one, on behalf of Mark, myself, and our research team, we'd like to thank the Alzheimer's Society because they have been great partners with us in assessing and implementing and giving us feedback. But in addition, when people connect with the local Alzheimer's Society, they are the most knowledgeable about transportation-related resources in the area that you live. So they can tell you about community driving resources, about maybe local shuttle buses from retirement homes that allow people who aren't in the retirement home but live in the nearby neighborhood to use to take them for grocery shopping and other types of activities. So it's a great resource. The local Alzheimer's Society will know about how they can help support you if you have to give up driving as well.
Great. Thank you. Thank you so much, Mary Beth and Gary and Mark, for joining us on today's podcast. I just want to say it was a wonderful conversation and it was a pleasure having you all here. So thank you very much.
Thanks for having
Thank
me.
you very much for having us.
Thank you.
If people would like to follow Mary Beth Whiten on Twitter, you can follow her at Mary Beth Whiten. That's at MaryBethWighton. And if you want to learn more about the Driving and Dementia Roadmap that we've been talking about, you can visit drivinganddementia.ca. And you can also follow the Canadian Consortium on Neurodegeneration and Aging on Twitter at CCNA_CCNV. We also want to thank our podcast production team, including Monique Chang, Nicole Pacampera, Lisa Hartford, and our friends over at Podtex.
To learn more about CABHI, please visit us at CABHI.com. That's CABHI.com. And if you want to support CABHI, you can donate at baycrest.org/donate to CABHI. That's BAYCREST.org/DONATETOCABHI. We'll be sure to add the address in our episode show notes. We'd also love your support of our podcast. So hit that like and subscribe button on YouTube, SoundCloud, Spotify, Apple Podcasts, or wherever you get your pods.